Okay, well, good afternoon. And um, another busy week, lots going on in different ways, but everything's moving in the direction it's supposed to go, and with our systems keeping on track of all the cases, dealing with that. So, the national situation, international, you have the numbers there. The main thing is to look at the changes again, and you can see the numbers are jumping up fairly significantly in South Korea, Iran, and Italy. In that, the numbers continue to peter down in China, and that'll be interesting when we calm down here. The U.S. is now up to 160 cases. They have their 11 deaths, most in Washington State, one now in California. And so the countries, again, we're under observation, mostly watching is Italy, Iran, South Korea in that regards, along with the other four that we had mentioned before. But there's increasing review by the federal level. Are there other countries who should be added to that list? General travel information is noted because sometimes people could be in airports in congested areas for long periods of time. So you may want to be aware of that and use your proper travel etiquette to limit that type of exposure. In that regard, in Ontario, we have we're well over 1,500 tests we performed on that basis. They're up to nearly 1,600. 1,466 are negative, so there's a few still pending. The number of tests per day have gone up. So I remember a week ago we were about 70. Now we're about 220 a day coming in. And so that shows you the response to increased travel areas and people coming forward requesting testing and physicians referring for that case there. It's interesting that we've had now our fourth case resolved. That was in the order there was the young person who had been to back in the past to Wuhan, where they had a questionable test when they came back here. So that was probably already resolving as it was. So as a result, all our cases related to China and Wuhan have now resolved. And we haven't had any new cases for a while, which I think mirrors the effects of what's going on. And it's important to look at that because as these countries go through these phases with their containment, ability to contain or not contain, and as it goes through with spread through the community, you start to get more and more immunity in the wider population, and you see the epidemic curve comes back down again. We want to watch to see if there's any secondary waves, especially in China and that. In there, aspects people talk about repeat infections. If you see that, instead of seeing the normal bell curve, it starts to look like a rippling effect out. And we're not seeing that yet. So again, we're learning from the Chinese experience there and with the WHO going along, looking at their data to tell us what's happening in there. Their deaths still have been concentrated in the more older population as those with comorbidity. And that's important for us to remember if we're looking at what does that mean for a Canadian population where about 80% of our population, the risk of any severe issues is quite low, even if they do get it. But that's something to keep in mind. That's not a matter of complacency, but that puts things into perspective as compared to some of our other things like influenza. Whereas again, last week we had 250 cases and 140 of influenza B, and there were some deaths and some number of hospitalizations. So how does that compare in that regard? We have our 22 total positive cases, the 4 resolved and the 18 that are moving forward. We have our 2 new cases in there. In that, and that was a 50-odd-year-old person from Iran travel, and that person is at home in isolation. And then we have another one, which was a new one for us, and you heard the press release this morning from Waterloo with a traveler from northern Italy who came back on the 3rd, was already symptomatic on the flight, tried to use precautions in that, and so they're following up on that with the flight mandate, etc. That person is also at home on isolation, but when they were there, they were seen quickly the next day with proper PPE and everything, so the hospital staff were not exposed in any regards in that effect. So, so that's a new one for us. First from Italy, with what's going on in Italy, I would be expecting some more. So that's not surprising. I think it was why I haven't seen one sooner. It was interesting to hear that, and that other areas around Ontario are not just Toronto, have many people and groups that travel back and forth to these areas. And of course, that's why the travel advisories are in there, to take those precautions, especially in those high-risk centers, and to do your planning accordingly, especially if you have other health conditions, and age being a factor as well in that matter. But it doesn't mean if you're young you could carry it back and give it to others too, especially if you have members of your family who are susceptible. You'd want to use proper precautions in that regard, and in your consideration of your travel and trips accordingly. So that means we have our 4 resolved. Our ones with Egypt, we have our 5, and we have the one who's was part of that travel group. I think it was a cruise on the Nile, and they're all doing, the 5 are doing well. Sorry. There are 5 cases. One is a contact who is asymptomatic and being monitored. And there's another case from Canada, not in Ontario, and there was a number that were from the U.S., and we've, through FAC, have passed that information on to the CDC for their follow-up with those individuals. So that's more of a cluster activity where somehow someone must have been infected, got involved with that event there. So we have 10 that have a travel history to Iran at the moment. 2 have no travel history, but close family contacts with cases. And now we have one of our cases in the hospital. One of the 2 was discharged, and so only 1 remains in hospital at this stage. And we continue to follow and see how that is going with the local public health area in that regard. Aspects of working at the Special Advisory Committee, reviewing our public health measures, looking at the concepts around mass gatherings, knowing that all mass gatherings are not the same. One should carry out on a chart an idea of assessing what is the risks in those various mass gatherings. What does it consist of? Who's coming? What kind of activities are you doing? How much is time people together? How much are people walking out and dispersed? So all this is saying that as you take that, and we're asking our local health departments, and people are planning mass gatherings, instead of saying outright no, well, let's talk with the organizers. What is your planned event? What are you doing? Who's coming? What kind of systems are you put in place? What checks and balances? And what can you do to ensure us that all safety precautions are taking place in that regard, in that matter? So that document's trying to come out to inform people of that accordingly. Overall, the containment continues well. The low risk of transmission in Ontario is low. We did do our parallel testing, where we are doing that with the Public Health Ontario Laboratory, and that's where they've taken samples that are coming in from a number of the hospitals of people who have shown up or presented either in the emergency department or admitted with influenza-like illness or undiagnosed pneumonia. And they're doing parallel testing with COVID-19, and they've done nearly 270 samples, and those all have been negative. But that's part of the wider surveillance, because people say, well, maybe it's circulating. So that would be the most likely group, because they would, if they're getting ill, they would be showing up at hospitals. But maybe if we're not looking for travel history only, maybe it could be secondary spread. So we're looking to continue that kind of surveillance out and around with our at-risk populations to see if we can identify and to be alerted if there's any cases show up in that group, so we can take action further and accordingly. The messaging overall, and I hear lots of comments about people as we're preparing for in our pandemic plan progression. We mentioned our command table. We have met twice. We're looking at key issues around there. We're looking at aspects about how do we quickly increase our laboratory testing capacity. And because, yes, our lab still has capacity, but we're not going to rest on that. How do we increase that capacity? How do we increase the access of people and the numbers to get assessed in that type of way? What methods can we use to do that in a safe way so people are not having any barriers due to time delays, not know where to go, language issues, all those things that make it, as we've used in Ontario, to say that people who've had a travel history, concerned about contact with the case, or other concerns that might feel they relate to that, especially if they're developing any signs or symptoms, how do they, in a timely basis, get seen quickly in a very welcoming manner, get assessed, sometimes even from home with phone calls and that. So we're trying to set that up, especially in our areas of highest intake, which is in the Toronto area right now and around the GTA, but it doesn't mean we wouldn't expand out beyond that. And again, that's only but the next step towards even further and higher surveillance in that regard to make that amenable and reasonable for people to access. As far as people making their preparations for these things, I would say there's a middle ground on what to do. I think you look at your own situation, where you are in that. The ones that are saying there's some issues around isolation, what would they need? You have to remember that back in the time of SARS, as I recall, because we were coordinating that, we had well over 20,000 people that went into self-isolation. And during that time, people did not run out of things in the household. They accessed people, neighbors helped out, because that's the Canadian way. And so, unlike what people see the situation and they compare it to what they saw in the pictures in Wuhan, that was quite a different situation. That whole area was cordoned off for almost 6 to 8 weeks with no transportation, very little in and out, including supplies and materials. That would not be our approach here in that kind of situation. And that was extensive, that was prolonged, and some were saying, would we have the same thing in Ontario? We would not have that situation in Ontario. But anyone who was in isolation, and we still say that now, if you're in isolation, self-isolation, and there's something you need, let us know. We can help you out in that situation. You're not on your own. While you're isolated, in a medical standpoint, you're not isolated from care and concern. And we want to make sure we want to emphasize that in proper preparation. At the same time, our ongoing activities for the public writ large is that we take collective action as to keep our containment under control. That means our messages you've heard many times, that we've been well versed in Ontario with flu season, with our cough etiquette, hand washing, and I see people want to buy lots and lots of volumes of alcoholic hand-based washes and that, and they're buying large containers to be in their house. Your house has running water and soap and water. Soap and hand washing is still preferable. If you can't, then you use the others' hand sanitizers in that situation. So use what's most beneficial and what's useful at that time in that regard. And so then the other thing is staying home when you're sick. And those are things we want to do collectively. When you're using mass transit, social distancing, proper hand hygiene in those situations. We all do it collectively, all work at it collectively. And that's the success of our program here in Ontario. So those are my main messages for today, and I'm happy to take questions. And as we see this situation evolving globally, countries going through their issues, some of our travelers coming back from those, asking people to limit travel to those high-risk centers, and they would consider delaying unless it's urgent. If it's urgent, then you're going to have to take your precautions and monitor that accordingly. People are having even advice now with travel. Look at the situation in the U.S. Where should you go? Where should you not go? And these things do change. And so you have to keep up to date. So what I tell you today is maybe something I'd tell you in 3 or 4 or 5 days from now. So that's just the reality of the situation, and really challenges everybody to do your research, understand what your situation is, make a decision on your personal situation, your personal need, and if you have personal health problems, especially the more at-risk population, then you may have to think twice about undertaking on some of those activities. So that's the update for today, but I'll be happy to take questions.
Why shouldn't Canada follow in Australia's footsteps and ban many of those foreign nationals from those at-risk countries and implement a mandatory quarantine? Wouldn't that help reduce the risk of COVID-19?
Well, I think that depends on how confident you are in travel bans. Our experience is that they only work to a limited extent. As you can see, some countries had quite strong travel bans, like the U.S., like Italy. And it didn't prove to be successful at this time. If people are determined to come, they'll find ways to get around it. At the same time, they can help. It depends on your ability to enforce, especially being a center like Australia, which is, because it's water surrounded, you may have better controls on those aspects. So it's a solution. It hasn't proved to be totally effective. Even our travel ones, even with our borderline measures, we don't rest on the fact that people have totally self-declared. We still want to use education. We still want to commit people to then come forward in a timely way, because our experience is that people still are very concerned. They're concerned about their own health and that of their family and members. They take more initiative on that than they want to obey the rules and laws, but they're very concerned about their health.
And there has been anecdotal evidence that those who are in quarantine or have been sent back home for self-isolation haven't really honored that. So how, or what would you implement in terms of making sure those people, how do you trust those people to make sure that they do stay in self-isolation if they're sent home?
Right. So the anecdotal information is interesting. I mean, if you're talking about our quarantines in Trenton and NAVCAN Center in Cornwall, I forgot to mention, that's over tomorrow. So that group in the NAVCAN Center will have finished their 14-day quarantine tomorrow. Tests have all been negative. Everyone's gone well, so that's our third successful quarantine and releasing from there. So I don't think you were talking about those ones. When we ask people to self-isolate, there's the two levels. One is people self-isolating as a precautionary basis, that they're not mandatory. If you are identified positive, or you're one of the ones from Hubei or from Iran, and you notified public health will be checking on you on a regular basis to see how that's going in that basis there. We so far found that most people have done it even before they're required to have done quite stringent self-isolation. Does that mean I know that everyone perfectly has done it? I think it's when people feel under pressure they have to go out and get something and they can't seem to get any assistance to get it and they feel desperate. We'd like to try and help on that situation. So our experience is more the opposite. Is there anecdotal evidence to the contrary? There could be. And then we asked our public health officials to follow up on that to see if that's either the rumor that is true or someone misinterpreted the situation. And again, we'd like to put the confidence first on the person and then check to see if that's true or not.
The deaths in Washington State and California, is the recommendation that Ontario should now be checking anyone who flies in and out of those states to Toronto or Ontario?
We haven't had a travel alert to that. There's, as I said, there's a direction from Public Health Agency of Canada that in order to just keep track of all these countries that are flowing forward, people with travelers from areas like some of those with symptoms should still seek to get an assistance on that. So has there been a travel ban or warning from Washington State? We have not heard that yet.
Should there be one, considering the fact that we've implemented one for other places where there have been patients with COVID-19? We're seeing deaths there. Right. Should there be those types of, not travel bans, or at least, precautions, checking every passenger who comes off of one of those flights as well?
I think we're going to be adding to that to our group as our list of travel there. I think the more concern from my counterpart on the West Coast is the common border and people moving back and forth. They do have a bigger challenge to handle there. So we're looking for how they're assessing the situation and how in our Federal Provincial Territorial Committee are they going to put that kind of, just what you said. We'll do it anyways because our people watching that, and if we get a phone call, I guess came from Washington State, we would say, well, don't worry. We would worry, and we'll follow that person anyways. We haven't put in that they have to have mandatory isolation, all those kind of things there. It hasn't stepped up to that level of risk as of this date, but we were looking for our Public Agency of Canada to put that on the list, yes or no, as compared to state by state, as compared to a whole country like the U.S. So we haven't put U.S. on, of course, but there may be some state issues that we might consider rendering and putting forward in regard of what you just said.
Dr. Raines?
Sorry, can I just ask about, there has been a lot of panic buying when it comes to hand sanitizer. What would you say to a lot of people who are stocking up on hand sanitizer, and is an antibacterial hand sanitizer even effective if you were to come in contact with somebody who had the virus or just the influenza?
Well, it's effective in the fact that if you're touching surfaces and touching that person, or that you might get it and introduce the virus into yourself. The other purpose is that if you happen to be coughing and sneezing in your hands, you do it for the protection of other people. I'm not saying you do the hand sanitizer handshake with a wet hand and pass it on, but we know that hand sanitizers are not as effective as a good thorough hand washing with soap and water. So that'd be my first advice. If you're bringing in big containers back to your house to use in the household, why are you not using your sink and your soap and your water? That'd be more important, and it has proven to be more effective in that regard. Hand sanitizer is meant to be around in mobile places where you don't have access to a sink and soap. But if you have places to public washrooms and somebody open the doors to the elbows and stuff, you wash your hands thoroughly, and that kind of, it's still available. So use those when you can. So that'd be my sense. I think hoarding and stocking other stuff, as I said in my preliminary comments, our situation would not be similar to the Wuhan situation. People that are going to have to self-isolate in that regard, we will assist them in any way we can, so they should not feel desperate they've ran out of something. I'm not sure why toilet paper is the biggest thing, but it seems to be one of the things that people like. At this stage, we could assist with that too if it was necessary. So I would say in things in moderation, especially things that are unique that you have for your own personal health issues that you might not be easily to acquire. You know your local situation. Someone's like renewal of normal prescriptions, but it doesn't matter. If you get some prescriptions way off too large, the pharmacist, one, shouldn't do it to say, you shouldn't have run out by now. Plus, some could expire. So you got to be careful what you're putting in your house and keeping in that, especially with medications and drugs, to make sure you're not stockpiling. And of course, there's a large amount of drugs that's hazard to children. You got to make sure you store them properly and all those kind of things. So it has its downsides. You just want to be, I would say, reasonable and cautious, and look at the data, look at the issues, and understand the context of what you're doing it in, and the wider support of the community in general here in Ontario and in Toronto.
I'm just wondering how long outside of the body the virus can live on surfaces and just in general. Do we know that at this point?
Generally, viruses of that level don't last long outside. The room temperature and body temperature is very important. So outside, and as I said, one of the advantages of Ontario and Canada, it's quite cold, so they don't last too long on those type of surfaces. It depends on what environment they're in. If they're in a wet, moist environment and something, they could last longer, but they don't last long in general in that situation. They're not that viable outside the human body in that extent, but they can stay on some surfaces for a period of time. They can be found, but of course, some of those tests that find those are PCR tests, which detects pieces of virus. Are they viable or not is another question.
I know that there were concerns in the United States about the stockpile of respirators and personal protection gear. Does Ontario have a stockpile of equipment and protection gear like that? And what are those levels at right now if we do?
Right, and that's one of the aspects of our command table is to continue to do an assessment of that inventory. With our PPE, we are getting our historical orders, which everybody was using the same amount they normally did, which if you look at the situation with COVID-19, we only have right now one in the hospital. In that aspect there, most of the people are on home isolation. But there has been, I think, some overusage and maybe misusage of some of the stockpile of supplies at the hospitals and facilities. So we're having discussions now how to be good stewards of what we have, to ask everybody to be, I would say, careful in their usage and use it when you need to use it, so that the more extreme ones like the N95s and that is available when you do need it. So we want to make sure, because the situation is on the global perspective, the availability is limited.
But so Ontario does have
Yes,
a
we have.
stockpile then?
Yes.
And are there plans to increase that stockpile?
Yes.
And just going back to my initial question, you said that the cold weather is actually helpful because the virus doesn't live long when it's cold temperatures.
At 10 below out on the surface, no.
As the temperatures warm up and we head into spring, is there more of a concern of transmission then?
Right. Well, it's a yes and no to that. As we usually see when the warm season comes, it's like when our influenza rates drop off. Right. And so it seems that the general immunity of the community tends to pick up, and the frequency of influenza, other respiratory viruses, starts to abate into March, April, into May. So that you don't see as much as you notice. We don't usually have flu outbreaks in the summer. Is it around a little bit? It's still around. We can still find it. It just doesn't seem to have much impact on the population. So is COVID-19 going to be the same? It could. Other ones have acted that way, but we have to wait and see.
Dr. Williams, you mentioned that one of the patients, the female patient, was showing signs of the virus on the flight. Do you know if she was able to get on the flight showing symptoms? Do you know what's happening to the people that were sitting around her? And doesn't this sort of perhaps argue for some kind of airport screening?
Well, they were supposed to do the screening. What they did because I think you've seen from their press release, the flights, plural, what was undertaken, how symptomatic was the person. I'm not sure if they had a fever or not, but they had some symptoms. So I haven't got all the details yet. I think what you speak of is an important point, that people symptomatic should not be flying or should be checked on that basis. I think the other thing is we do have the manifests. We're going to work through that area of contacting those people. It's interesting that in talking at the federal level, of all the flight manifests we've done and contacting those people, we haven't found any positives yet. That may be reassuring, but it doesn't mean we won't do it. We should still keep doing it. So we want to follow up on that. So that's still work to be undertaken at this stage.
Dr. Williams, on a pretty basic level, why do you think there's been no local transmission of COVID-19? All of our cases are, people returning from overseas where there are cases.
Well, remember they had there is too local with the family members in that sense. And that, as I said before, it seems to be a virus that transmits with very much close contact. So casual contact does not seem to be a major issue in there, like walking by someone or saying hello and that kind of stuff. You have to be in fairly close space with the person for a period of time in order to get it. I think also, I think I like to say credit because I watch it. I think a lot of our Ontarians are very have been versed for many years on cough etiquette and that kind of aspect there. We're looking for community spread. We're doing this alternative testing. We do our contacts with these people in the wide one around there and wanted them to say, did you develop any symptoms? And they're not developing symptoms. And we come up with negative. Just said all our tests, nearly 1,600, we only have our 22 positives. So is that reassuring? Yes. Is it something that we would coast on? No. We still go looking for it. So the fact that we're not having widespread community means the risk is still low to the Ontarian population. Do I take the assumption that that won't occur? No, I don't take that assumption. I'm going to keep looking for it. We're going to keep looking for it. And when we think that's occurring, we would tell the Ontarians and the public that's the case because our strategy would change accordingly.
Sorry, Doctor, I got a couple of questions coming in from colleagues in the newsroom who are working on similar stories. So one's asking, if someone suspects they have COVID-19, who should they call? And then another one is if someone elderly is traveling to northern Italy, which is the case in this particular story, what precautions should they take?
Wow. Okay. Our message is when you have concern, you call telehealth, and they can direct you to the local public health department. You can call your local public health department if you know that number. It's also listed on the webpage. So there's many sources to call. You may want to call your healthcare provider. Call first. Don't go to the waiting room, especially if you've got symptoms. You want to call ahead and get advice whether they want you to come in the waiting room or not, and whether they want you to go to a place where they can get a full assessment and sampling taken. If the doctor or healthcare provider feels on the phone that you fit the case of a PUI, they may want to encourage you, instead of contaminating the waiting room or being there with other patients and disrupting the clinic, to go to a center and get assessed, and then you can do that. As a traveler, and that's what I'm saying, if you're elderly and you have comorbidity and you're going into these hot zones, that is with considerable risk because you have no idea what the community spread where you're going to come in contact, and you quite likely have more than a short course flu. You could end up in hospital and you could end up with more dire consequences. We've seen that's the data, that's what shows. So I would certainly discourage elderly people with comorbidity in that to not go unless it has to be so critical, and then you're going to have to take a lot of careful precautions throughout your travels. That means social distancing and hand hygiene, and be careful who you're talking to. It wouldn't be anything but a relaxing trip.
Doctor, just back to Antonella's question about on flights. We have seen that some airports in other jurisdictions are taking temperatures as folks get off the plane, and also when they're getting onto the plane. Do you see a point, or at what point would that be a prudent step for Canadian airports to take?
The temperature monitoring from our assessment in the past is not very accurate. A lot of people present without fever at all, especially if you're coming quickly from outside, and some people actually end up with a temperature of hypothermia on the measuring system. So it's not a totally accurate system. So we would rather hear the cadre of symptoms rather than just fever only. It's one tool. It's not, I wouldn't say because it's the temperature, therefore no worries, because the person has no temperature and is coughing, blowing their nose and dirty and that stuff, they're still excreting virus potentially, even though they haven't got a fever at that time. So I would say it's only one in the toolbox. We haven't put a lot on that one per se here in Canada.
Who's the, I lost track, because I thought we didn't have anybody in the hospital with this anymore after that first gentleman from China got out of Sunnybrook. So which is the case that's still in the hospital?
That was the older one, was on one of the ones on the trip to Egypt, I believe, in the York region area.
Right, okay. And how is that patient doing?
I haven't got any up-to-date reports today yet. I think it's still wait and see. So we're hoping for the best. Yes, so we haven't heard any, I haven't got any reports from York Region Public Health today per se on that patient. in that, so we wait to be informed on that.
Are there any places in the United States that you personally would not go right now?
Well, because the state declared a state of emergency in Washington State, and are not sure about the extent of community spread, most of the ones are in that nursing home. So it seems to be clustered around that area there. Is it one that they can cordon that off in that area? Have they done further wide state testing? I have not heard that yet. So I really don't know what's happened in the state there. It may be very much cordoned around a certain area in a cluster. California, I don't know how their documentation of community-wide. They have raised that concern now, and so they're on a rapid process to assess that as we speak. So those are the areas I'm mostly concerned about. I haven't heard a lot per se down the eastern seaboard, central part, but we'll have to wait for CDC and authorities there to keep updating us on their data. As you've heard, they're really trying to ramp up their testing processes and everything at this time. So we'll probably be more informed as we go ahead in the future.
Sorry, this all
Well, thank you. Thank you.